welcome to A Shot in the Arm. My name is Yvette Raphael, and we are reporting to you live from Seattle at the CROI conference. Ben, tell us today, why are we here, and why do you want to do this podcast?
Well, this is I think, a really important conversation that we're going to have with my dear friend, Heidi Larson. We've known each other for hundreds of years, and never will I forget us at the Winterthur military barracks in Switzerland as we were preparing for a conference, but that's for another conversation. But Professor Heidi Larson is giving a presentation, is speaking at CROI. And as an anthropologist, this is hugely exciting because it's really about, I think, how we rebuild, and I'm going to pick my words carefully here, Heidi, mutual trust between society and science, particularly clinical science. And CROI, of course, is very intentionally, very deliberately introspective. It gives the chance for infectious disease researchers and practitioners get a chance to learn, to share, to talk with each other. But I think after COVID, that ship has sailed, and I think there is a need really for us to be much more intentional about how we communicate the science that we're exploring with society and help society understand that the science is an iterative nature. And so with that, Heidi, why are you here, and what are you hoping to share and to learn from CROI?
Well, to be honest, I was actually a bit surprised that I was asked to speak because it's not typically a conference that pays attention so much to the outward communication and is much more on the basic science. But to the credit of the organizers, I think they recognize that already there was a social dimension of the sessions, but that it's really important in this very challenging communication environment with the risk of things being distorted and disinformation and misinformation, that it's really important to have scientists themselves start thinking about ways to inoculate people, as they say, with the truth, the facts.
Yvette?
I am just in awe, Ben, and I'm so glad that we have Heidi here today. And personally, I have my own issues and my own mistrust. I think, Heidi, if you heard the opening session, you know that I talk a lot about mistrusting the system, mistrusting healthcare workers and how they treat us. And I just think this is an opportunity for us to really reflect on that. And what are your thoughts about that? And around us, just how the healthcare system, we don't trust it as community.
Well, I think one of the challenges that I see is that there are situations where people, I understand why they don't trust. And we can't be talking about building trust when there's not a trustworthiness on the part of institutions. So we need to find stepping stones for rebuilding that trust. And as you said, there needs to be a mutual trust. But I think we have to be very careful with distinguishing trust in science, trust in scientists, trust in the health system, and trust in health professionals, because they're very different. There are people who don't trust the institutions, but trust their health professionals, and they trust the science, but not the scientific institutions that are communicating it. So I think in our work at the Vaccine Confidence Project, but more broadly in what we're increasingly calling the Confidence Project, is really trying to disentangle where those trust levers are. Because trust at the bottom is really about relations, and we need to understand where the challenges are and how to rebuild that. But that is a problem when we don't have institutions or governments that are always trustworthy. So we have to find other ways where the trust is. And COVID has been amazing in the sense of when people ask me where the successes were, they were hyper-local. And we really have to build on that and leverage that and keep that going. And I think one of the best things about it is it was outside of the health system. And vaccines in general, after working for many years in AIDS, which one of the wonders was the inclusiveness, the all of society ness of particularly the early AIDS response, was that it was so inclusive. And when I started working in vaccines, it struck me as being the most siloed of all health interventions.
Yes.
And I think, it's polio got it a bit out of the box, but that was oral drops that anyone could give. So it was a bit different than having to be trained to give, injections and some of the other things that are needed for training around vaccination. But still, I know we're not just here about vaccination, but that's something I happen to be spending a lot of time on.
Well, it's very timely, and of course we've had the results of the Mosaico trial here, where we, despite our best efforts, we still aren't close to an effective HIV vaccine. Although there's some good bits of news coming out of it for future research. Picking up on Yvette's question, one of the things I was really keen to ask you is that your approach to fighting misinformation is that you do not dismiss the denialists. You don't demonize them. You almost have a sort of respect for them, or at least a respect for their right to have concerns, an acknowledgement that those concerns are probably rooted in understandable fears and history and heritage. And you use that as an entry point in re-engaging, not perhaps necessarily with the, how shall I put this, the extremists, but certainly with the broader public. And is that a message that you find scientists respond to?
I think scientists have a hard time with people who don't accept the science for what it is. And I think that that's been quite a jog to their professional integrity, and it's been hard, but it's very real, and I think a lot of people are dealing with it in different ways. And certainly in the context of COVID, we had unprecedented levels of attacks on scientists. I mean, the aggression was towards scientists, sometimes more than even politicians, and it was because the scientists were informing the policies. So the public felt like science says, therefore you do, so shoot the scientist. And it was pretty aggressive in ways that, I mean, it's not that there hasn't been historic aggression towards scientists at different points, but this has been different. But coming back to what you were saying, Ben, I think that there is a spectrum of the people. My concern for a while, and in my book Stuck, is very much about this vulnerable middle that are not overtly pro vaccines or other technologies, or on the other side are not part of this very aggressive disinformation approaches that are purposefully trying to disrupt for other reasons and outside, either for profit or for polarization or whatever. There is this middle ground of people that, I think they, as I said, sometimes there's a reasonable, I understand why they don't trust certain things, but we need to at least hear them out. Once you hear them out, and then are they more in the extreme camp or the still thinking and open to being open to going ahead with a vaccine or whatever, even medications. I think we have to pay attention to that and listen more and not just shut them down or judge them.
Well, which sort of brings us back to Yvette, and I know your phone is going off. This has been an extraordinary conference for Yvette. Her opening plenary, I'm sorry to say this, but it absolutely electrified everyone. And Tony Fauci found you an exceptionally hard act to follow. and was and
You
constantly
say
I
so,
love
yes.
that.
and referring back, yes, Yvette, I'll do this. Yes, Yvette, I promise we'll continue working on a cure. But the communities that you work with, Yvette, are very much in this middle ground that Heidi was talking about. You don't, the communities are not ones that necessarily have a ideological opposition to science or to some of the scientific policies that are happening, but more a question of distrust with the system. And
Yeah,
and I
and
wonder if that was resonating with you.
yes, most definitely. And I wanted to stop Heidi when she was speaking because exactly that is that our communities do not know the difference most of the time of who is making the policy. So if you're in Khayelitsha in South Africa and you have to get vaccinated, you don't know who's making that decision. But all you know is that somebody is making a decision for you to get into a position where you have to get a vaccine. And what I also found with COVID is that we had a missed opportunity there by educating our communities and not listening to our communities. And that was what my talk was about, is that scientists, the establishments needs to listen more and just listen to communities. I'll tell you one thing that I found is that in South Africa, mostly our communities did not mistrust the vaccine. They mistrusted the fact that it was called a vaccine and not an immunization. So they actually were okay with taking their children for immunization when they were born. You know, the South African policy up to about 13 years, do you take your child for immunization? And when we as advocates and activists wanted to explain to them that there's nothing different here with what you taking now for COVID and what you've been giving your children to against some of the diseases, TB and all of that, smallpox and all of that. And they understood that, oh, wow, now why are they saying it's a vaccine? Why do they make it as if somebody came out and, like you said, somebody decided that everybody should do this?
So they saw a difference between a vaccine and immunization.
Yes, they did not think it's this, they thought it's two different things.
Oh, that's interesting.
Because the language is also important, is how you translate that sign.
Absolutely.
And the vaccine was because of also how it was projected on television and how it was shown that it's some people's decision and some people that we cannot name today were the culprits, and they just thought, okay, somebody is in charge of the world and want to change world order, and communities are not stupid.
Yeah, that's a very, even for somebody coming into vaccination work, I think that speaks to the fact that we need to do better explaining, because a vaccine is a product. Vaccination is actually getting the vaccination in your arm, and immunization is when it works and you're protected. So they're all part, and when I would hear something like that, I would think that we need to get out there with, maybe an infographic or something that says, this is the vaccine, this is the vaccination, and then immunization, and have some kind of halo over a kid or something. And, when it starts doing its work against protecting against virus, because you don't have immunization if the vaccine doesn't.
Yes, but in our communities, it's an immunization. That's what they say. That's exactly that you get your child immunized. And that is what the people in the communities understood. And they understood vaccinations to be different. And they did not accept
So
it.
interesting.
Yes,
Yeah,
from our point of view, but like where I sit and work with communities, I wouldn't exactly know why they would feel that there's a difference.
But then I think it's up to us as a community of in working in health to explain that it's the same. The principle of it is the same.
Yes.
It is against a different disease than the measles vaccine, but it's an immunization. That's interesting. I think one of the things that happened during COVID that is exceptional and doesn't happen typically with vaccination or immunization programs is that the public the curtains were open on the whole scientific process of making a vaccine. I think most people didn't realize that it takes so long for a vaccine, normally 10 years even, to go from basic science to get to people. And all of a sudden there was one that was made quickly. But they probably didn't know before how long it took until people started saying, oh, this is so very quick, Operation Warp Speed, you know. And also, people don't normally ask about which platform a vaccine was made of. They want to know,
Right.
is it the one for measles or the one for polio? They don't say which brand is it. They don't say, is it X They don't know, and they don't need to know, or they can know. I mean, obviously the information should be available, but what's happened is by throwing this all out there and having people, you know, being taught what an R naught is and what a lateral flow test is. And I never thought I'd hear a taxi driver say, I had the lateral flow one. I went, you know, you think, and there are opportunities in that in terms of public awareness about science, but it all came rolling down the pipeline at a rate that was a little too much. And I just want to know, what am I supposed to do? And this isn't, and if it came out as also not being like an immunization, that's another complication. And the world order conspiracy is totally world. I'm
Oh,
hearing it.
yeah,
I
that's
we
actually something I wanted to ask you about.
Yes.
It sort of picks up from what Yvette was said, the attitudes that we have to healthcare workers, to immunizations, to immunizers coming to our communities. Going back a couple of American administrations, and this is something you and I have spoken about in the past, the assassination of Osama bin Laden in Pakistan. One of the ways that the CIA were able to locate creating a fake vaccination campaign. And how did this affect attitudes of everyday Pakistani people, and indeed perhaps more broadly across South Asia and the Muslim world, towards vaccinators, to immunizers, people coming into their communities to offer vaccinations?
Well, it was a disaster, actually. The CIA, as you said, they did it was like a house-to-house, faked a house-to-house vaccination campaign for hepatitis, which doesn't even go house-to-house. But the one house-to-house vaccination that was going on in Pakistan was for polio. And it was at a very vulnerable time of the polio program, so it was not, as one colleague said, why couldn't they have picked the milkman or something? But they picked vaccination, and they did identify the house. But what's happened is that, as I said in one interview, it gave credence to conspiracy. I've done a lot of work in the polio campaigns over the years in northern India and northern Nigeria, and places that were really stuck on this idea that this was sterilizing children, and there was conspiracies, and I felt or they're being spied on, or this is why they're sending people around. And I said with great confidence, this is only in your child's best interest. There's no spying going on. There's no this. And after that event, I have to say I couldn't have done that work. It really undermined the public, undermined the respect of the vaccination campaign. But what was interesting is that UNICEF, for instance, did a survey with parents, because there was an initial outrage by some immunization programs saying this is really bad, it's going to undermine everything. And UNICEF did a parent survey and found that actually there weren't a lot of parents paying attention to that, and that we shouldn't worry so much. But I said, we're talking to the wrong people. The people who are going to leverage this is is the Taliban, are the gatekeepers, are the people who are going to be blocking access to immunization campaigns using this. It's not the parents. The parents want the vaccine. So we have to make sure we're asking questions to the right people and thinking about where the implications of these kinds of things are. Because it's not necessarily the parents. It's gatekeepers, it's other people, it's the system. So I think we have to have a bit more nuanced understanding of the implications of these things.
Yeah, and I think the issue around transparency as well. I think governments, policymakers, a lot of people did not just say they don't know and wanted to have people get vaccinated, go to the clinics, but in actual fact, they didn't have the answers as well. And that is where the community shut off. I would tell you that one, in South Africa, there was a huge difficulty and still is. The men did not want to get vaccinated because they thought it had something to do with them not reproducing babies. Like literally, I'm not getting a vaccine for COVID because I think something is happening here. Somebody is trying to do pop control. Secondly, also around the side effects, who died of getting vaccines. Nobody was really prepared to speak to us about that. And people started creating stories. I know of databases, WhatsApp groups in South Africa where people literally said, my brother went for a vaccine, he died after 2 minutes after the vaccine. And that is the data that the community collected for themselves because researchers and governments were not prepared to talk about that.
Yeah, I mean, when we talk about evidence, we will say the evidence says, and communities say, well, we have our own evidence.
Which is our stories.
Which is, and evidence historically is about testimony, is about seeing, about witnessing. And the kind of evidence that we have, for instance, with big data now is very far from actually experiencing and testimony. But what communities might see as one incident or one thing then gets inflated to what they call sometimes the social amplification of risk. It just goes totally viral. There were some risks with some of the vaccines, but it wasn't to the extent that was inflated. And that's where I think a little bit of honesty about the fact that there is some risk, but it's just not as big as but that to parents, they don't care. If you say there's 1 in a million, all they care is that one
That
is
1
not
million,
my child.
Yes.
But here's a question, and I think this brings it back to CROI. But the whole process of scientific investigation, clinical scientific investigation, is about trial and error. And one of the things that we didn't do with COVID, and Tony Fauci got into trouble for this, is your guidance changes. 1 month, don't wear a mask. The next month, always wear a mask all the time. And I think part of the problem for us, particularly in the West, is that we've created this sort of classical, empiric, Newtonian idea of the primacy of the scientific investigative method. And we think that our scientists sometimes are gods. And if they're not telling us consistent things, we notice that. And I don't think we've done a good job explaining, well, this is what happens with science. We learn more as we go. And I think there's a real need for us to, as part of our process of engaging society and science, I think it's really important we set that out.
Yeah, and I think that, but it means that health professionals and scientists need to say, this is what we know now. And we're continuing to learn, but, and I know that's a hard thing. Also, the public is very demanding these days, and they don't want to hear that it's evolving. I mean, they want to know, well, when is it going to stop evolving, and when are we going to get the final result?
Yes.
So we have to find something between the honesty of the process and when is enough evidence enough to make a policy decision in the interest of saving lives. And that's not an easy discussion, particularly for people who are distrusting. I mean, it's one thing if you have people who, have enough trust that they say, okay, we understand that,
Yeah.
But when you've got people who, for historic reasons or for contemporary reasons, are feeling like, I don't trust this. It doesn't make sense to me in this world order thing. I've heard it in the corner shop in London. I've heard it in different parts of Europe. I've heard it in Africa. I've heard it in India. It's amazing to me how, I mean, the person that I talked to in the corner store was saying, I said, so did you get your vaccine? And he said, oh, no, it's not for me. And he asked me if I did, and I said, yeah, I mean, my husband almost died of COVID. Of course I got my vaccine. And I said, you don't trust the government? And he said, no, it's not even this government, it's the world government. It's not for me.
Yeah, and that is exactly where the difficulty is. And for us, community advocates, we also thought it's going to make the HIV, the whole research sphere for HIV difficult. And it did, because now people are asking, why did you get a vaccine so quick for COVID? Is it because it affected the West so much? Why is there no vaccine for HIV? And those are some of the difficult questions that we have to answer if we want communities to continue trusting the science.
So here's a question for you both. Actually, this has been quite a magnificent conference in terms of the science that has been presented, and frankly, in ways that idiots like me can understand. So I'm really grateful to CROI for that. But there has been, I think, a really healthy tension emerging here. And one part of that tension is that we're seeing data, particularly around HIV, well, and Mpox as well. But we're seeing research that is conducted in gay men in the North, men who have sex with men, and research conducted in the South, primarily girls and women. And I'm thinking of the STI treatments, right? The headlines appeared to be, wow, we're seeing that, prophylaxis with gonorrhea treatment is really great for gay men. Oh, but it doesn't have any effect on girls and women in Kenya. And we sort of began, and it's all about intervagina as opposed to interrectal penetration. And then we were also seeing it in terms of, in a slightly different way, with the two clinical trials for the Mosaic vaccine. There was a trial first with girls and women, and that was brought to a close well before the continuing trial with men who have sex with men was brought to a close. And so there was an interesting dichotomy there. And then there is this need to prioritize science for the South, for girls and women particularly, but for the bulk of the population in the world that are really at the front line of these pandemic threats. And I just wondered, both for Yvette and for you, Heidi, how you feel about this tension and how we go about sort of nuancing it and bringing it together.
You say it's tension, Ben, and I would give it a shot first, Heidi. Sorry about that, because it really makes me angry. It makes me angry that first I want to just talk about PrEP, is that PrEP is actually something that could have been a game changer for women because it's what we have now. But clearly it does not work that well for women. We don't know if it's whether they are taking it, whether it's just so difficult to explain to a woman that you're going to have to take a ARV all the time for a disease that you don't have, and it's going to prevent you from getting HIV. But on the other hand, we have men who say, okay, results that say men can take it as and when they want to have sex. So why doesn't it work for women? So that makes us angry. It makes us angry as well, like you say, that some of these things are tested on us and they don't work for us. So when do we get to a point where we say we've had enough? let us focus on stuff that works for women. I would like to say maybe BNABs. And this excuse that our uh, biology makeup is different. It's no longer, it doesn't fly anymore. Science has done miracles. You've gone to Mars. Come on, I'm sure you can find your way into the vagina of a woman. And I get that angry about it because we are the ones, and now we sitting here with a ring, and we want it, and nobody wants to give it to us.
The Depivorine ring.
Yes. Sorry, Heidi.
No, but I think you've said it well. I mean, I think I couldn't say more on it. I mean, I think there's a sense of there's clearly something going on with the science there. I don't think that there's no intentional reason that it's working more with men than women, but I think what your point is that we need additional extraordinary investment
To find
to
stuff
find
that-
something for women.
Yes, specifically for women,
Yeah.
and say, okay, we've got enough now. Men can literally prevent themselves from getting HIV because they can just say, every 2 days I take this pill and it works, and I don't have to take it for all the rest of my life of 72 hours before. Now let's focus on finding something for women. And how do we make it better?
But we know that because of the research to date. Because without that research, we wouldn't know that there's a different efficacy, which now gives a mandate to say, okay, we need to take this the extra mile for women, because we wouldn't know that without having done all this research.
But is there that extra mile for women? Or are we
Well-
just doing science because of science? We're hoping it would work for everyone. What we want to see
And it hasn't, so, yeah.
exactly is a focus for women, a focus on adolescent young girls and women, because everything is against us. And my personal thing is that I have a daughter. She's born HIV negative. I want her to stay that way. But I know if there are no, biomedical interventions, her will and her willpower and her strength is going to just, at some point, is not going to work.
Yeah. Well, I think there's an advocacy campaign we need to work on, and you can sign me up.
Most definitely, Heidi.
So we're coming up, I guess, to the top of the, we've reached the half hour that we assigned for this. But I don't know quite how to do this. Yvette, you had a question for both Heidi and me. And feel free to, I'll give you it here.
Okay, alrighty. So between the two of you and Ben are also always getting into trouble, and you are at it again with the Global Listening Project. What are you guys doing now? What are you up to? Please tell us. Tell the listeners.
Well, the Global Listening Project was something that initially funded by the MacArthur Foundation, and I was very grateful for that. And the idea is to listen and to capture the experience of communities and publics during COVID, because I just felt like a lot of the pandemic preparedness and other preparedness efforts were very much about systems, were about supply chains, were about surveillance, all important. But I didn't see any explicit approach to societal preparedness, nothing about how do you prepare people. And one thing that was loud and clear in COVID is governments were having a hard time bringing publics along with them. And I think it's totally reasonable that totally understandable, I should say, that they weren't bringing them along because they hadn't been prepared. I mean, the systems were prepared, and we have such diverse publics that we really need to work and understand that. And that's not something, societal preparedness cannot be informed by a group of experts in Washington or London or Geneva or wherever. We need to learn it from the people. So the Global Listening Project is out there doing different kinds of listening exercises through focus groups, interviews, surveys, in-depth interviews, case studies around the world. And from that, we're going to distill what we're calling a societal preparedness index, but also quite a few case studies and stories that can help bring the people's dimension to preparedness. And we want to get these findings on the desks of policymakers and other people who are, working on preparedness to say, you have to think about these issues. The reasons you didn't bring these people along was because of X, Y, and Z in their mind. They were willing, but they didn't have the right, as a number of people told us around the world, there was this big disconnect between governments and their experience. They said, we had all these guidance coming down from the top, but it didn't relate to my situation. And we need to do better at disaggregating policies to be relevant to people's lives. Otherwise, you can forget about it.
Yeah. So over to you, Ben. And after that, I think you have to close us out.
I do indeed. And just a thank you to Heidi. I know you've got to rush down to Ballroom 5, I think it is, to Ballroom 2 to give your presentation. Thank you so much for joining us. This has been a really fascinating, intriguing conversation. We've had a lot of comments on the live streams across Facebook, LinkedIn, and YouTube. So thank you so much. And we will see you again soon. Now, let's hope I get this right.